Good afternoon, good evening. I'd like to thank Dr. Anas Anbari and the Oman Ophthalmic Society for your very kind invitation to speak to you today about laser vision correction monovision. I should rather use the term blended vision for two reasons. Blended vision is much better understood by your patient than the term monovision, and blended vision grows your practice. My financial disclosures that have relevance here are in red: Alcon, Viveo, and Wavelight. The first thing one needs to understand about blended vision is that it is a compromise. We would need 3 eyes to be able to see far, intermediate, and near if we were presbyopic. And as we know, we only have 2 eyes, so there's always going to be some level of compromise. So how do we go about determining the suitability for blended vision? So first of all, on the phoropter, correct both eyes to 0, and then at the click of a button, show the patient 0 minus 1 or 0 minus 1.5, and ask them to rate it compared to the 100% that they assign to both eyes perfect. And the moment they rate this at more than 80%, there's a very good chance that this will be accepted. The next thing to do is to see at what level of defocus they still have stereo vision, and to normally use this as the extent of how far you can defocus the reading eye. A trial frame worn in the clinic for 10 to 15 minutes is very useful, and for the very few occasions where the trial frame does not give the answers, one can do a contact lens trial for a few days, and this will typically give you the truth. Right, so explaining to patients, if we correct both eyes for distance, both eyes at 0, you're going to need glasses for intermediate and near. You'll be free of glasses for distance. If we do one eye at 0, one eye at -1, you'll still need glasses for near. If you do one eye at 0, one eye at -2, you're going to have this gap in the middle where the computer is. If you do something like custom Q or presbyond, where you extend the range of focus, you now have 2 areas covered. So for the emmetrope in both eyes, you see far and intermediate with no glasses, but still needs glasses for near. But now when you do a defocus with one eye at 0, one eye at -1, you get a very good range of vision, and instead of there being a gap at intermediate, there's now in fact an overlap at intermediate. And then finally, the only other option that gives you this level of range of vision is a trifocal, but as we know, trifocals come with dysphotopsia issues. Viveo is a very useful device that is a wearable worn on your glasses and used while you're assessing your visual needs. And data is collected over a 36-hour period, over days, and this leads to a personal defocus curve, and this in turn is matched against how certain solutions look. So if both eyes are emmetropic, you need glasses for all of this unshaded period. If this person does 0 minus 1, you increase the range of vision by 22%. If they do 0 minus 1.25, this is increased by 29%. And if they do 0 minus 1.5, it's increased by 44%. And finally, if they do 0 minus 2, it's only increased by 38%. Of course, they gain near, but they lose some intermediate. But Viveo is exceptionally useful in showing you exactly how a particular solution is going to match your personal defocus curve. The post-operative course is very interesting, and if patients know what to expect, it's much easier. They need to know there's going to be conflict early on with the 2 eyes competing. This lasts up to 6 weeks. And then there's a period of adaptation that's quite neutral. So the eyes are settled, but the patient knows which eye is doing what. And this lasts from 6 weeks to 6 months. And then finally the blending phase. And now they no longer know which eye is doing what. And this lasts from 6 months to 2 years. The beauty of blended vision is that troubleshooting is very straightforward. There's very simple brain training. This video will highlight how you can do this. And then finally, glasses can correct any issues with blended vision, for example, night driving. Thank you very much for your attention.